Now today I'm just going to talk about a few postural problems that are common in other parts of our body. And gravity is affecting all of our body. And eventually it takes an effect on our feet even. And one of the effects is we start to gradually stretch our foot out and make it a little bit longer, and that pulls on some of the connective tissue at the base of your foot, and that causes problems like plantar fasciitis. So one of the ways we can counteract that is doing this exercise we call short foot. So there's a muscle at the base of your foot that originates from the front of your heel, and it actually, when we contract it, it pulls the foot up and makes it a little bit shorter. And you can see the arch of my foot gets a little bit higher and deeper from my normally very flat feet, so just by contracting that muscle. Now, I'm not curling my toes, and I'm not going up onto a tiptoe position. I'm just contracting the muscle at the base of your foot. It takes some practice, but once you discover how to engage it, it's fairly easy, and you can do it while standing in line and waiting for other activities. So short foot is the first one. The other exercise that most of us need help with is stretching our calves. So we can stretch our calves this way against a wall. We should always stretch them once do a stretch with the calf with your knee fully extended, and then do another stretch with your knee bent a little bit. There's two parts of the calf muscle, and you'll stretch both of them if you'll hit both those phases. For our knees, our most common postural problem is we start to lose some of the flexion range of motion. So this stretch is probably best done from standing position. So just stretching your knee into flexion. Another benefit of this is it stretches one of the long muscles that actually inserts on our pelvis, so it will help to minimize that forward pelvic tilt that we're trying to avoid. So for knees, we're trying to stretch into flexion. For our hips, we want to stretch the hip flexors. So I'm stretching my right hip flexor with this movement. You'll get a little bit more stretch if you'll reach up and turn away as you're doing that stretch. If you have trouble on one hip, I usually tell people just to do right, left, right. If I have more problems on one side, try to do twice as many stretches on your bad side. So you'll do a right, left, right stretch if your right hip's giving you more trouble. For our lower back, we've covered some of the stretches that we want to do for low back health, mostly neutral spine position and those extension stretches. For your upper back, we want to do movements that decrease the curve of your upper back and increase the scapula retraction motion. So pulling your shoulder blades back in towards your spine and also down. And then with your head, we generally wind up with a head forward posture. So we want to just work on posterior glide of our head. So our head sits back over the rest of our spine. Good posture generally is defined as your ear, shoulder, hip, knee, and ankle are all in the same plane. So we want to keep our heads back, and our pelvis tilted up, keep everything in that same line. And hopefully that'll keep you feeling good.